my pleasure to be able to have this conversation with you. I'm Dr. Ertenisa Hamilton, the Director of Primary Healthcare Services at the Ministry of Health. First of all, I want to say that yes, we have relaxed the measures within the country, and that was mainly due to the successes that we received in relation to our vaccination coverage, with most of our adults coming out to be vaccinated. At this point in time, we have at least 86% of the adult population who would have received the first dose and 67% with the second dose. Now, in relation to your question, the risk is still there, especially for those persons who have not received their vaccines as yet, and those persons who continue to be in risky situations. And so at this point in time, we are still seeing cases of persons who are infected, and there are a few of those cases where we're still seeing death among the population. Remember, of course, that COVID-19, when it would have arrived, there was still that population that is very at risk, especially persons who are older, persons who have comorbidities. And so we still have to keep that in mind, even with the relaxed measures that are in place. You know, the thing is that I always recognize is that, and we should say that even from as early as nursery and primary, one of the things that you learn is that you should wash your hands. And there was a reason for that, because it is clear that it is one of the most efficient ways of removing germs and any other harmful organism. And so that still remains one of the pillars of protecting yourself against COVID-19, ensuring that you sanitize, ensuring that you wash your hands, ensuring that you clean your surfaces and your environment. Of course, wearing your mask, because it assists with protecting you against the virus and the transmission. And we still advocate very clearly that there should be that maintained distance between two persons. So we have to look at it in a very logical way. We know for a fact that during our rainy season, we do have a lot of flu viruses that would be around. And so persons will get the flu, persons will have more instances of common cold. And what we should consider is that a lot of the symptoms that you have with these diseases are the same as with the COVID-19 virus. And what we would have seen is that the symptoms would have evolved or changed over time. And so a lot of persons who are COVID positive will come with the same symptoms: runny nose, they will come with a sore throat, they will come with fever, they will come with a cough. And so at this point in time, it is a little bit more difficult to be able to differentiate whether it's a common cold or whether it is the COVID-19. And that is why your measures are so important, because if it is that you're protecting yourself, you will see that your susceptibility to being infected reduces significantly. But also, one of the things that we can and we have been paying attention to is that for the common cold and for the influenza, you find that the symptoms do alleviate very early. One of the things that we recognize with a lot of persons who may be having the COVID-19 is that you're going to have that case. A lot of persons started complaining with the sore throat being one of the first symptoms that they have, and then you have the fever and the coughing and the runny nose coming as well. Not to say that the seasonal flu doesn't have the same symptoms, but you also have that general feeling of feeling unwell and not being able to do much, added with muscle aches and pains. So we know for a fact that it isn't so prevalent for persons to complain of that general overall feeling of not really feeling well when they have the flu. It may be possible for some cases, but all in all, we do suggest that if you find that your symptoms are there and they're not improving over that 2-3 day period, then you should have a COVID test done to ascertain whether you are COVID-19 positive. In most cases, the flu do alleviate within that 72 hours going on. And so at that point in time, we do ask persons if it is that you're having those symptoms, that you get tested. Recognizing very clearly that you need to know your status so that you would be in a position to protect other persons. And so yes, that's the advice that we would give to persons.
And how can you address this? Because
the thing is, with gastroenteritis, you do have different causes. Some of it is bacterial, some of it is viral. And with most viral infections, even though a lot of times we have the upper respiratory tract infection like the cough and the cold and the flu, there are persons who can have a viral infection and have that being presented as a gastroenteritis. And so because we're in that season where it's rainy and you have a lot of viral infections going around, that may be one of the probable causes of persons having viral infections that presents itself as the diarrhea and the vomiting. But also to mention is that some persons who are COVID positive do present with the same cases. And so if you're in a position in which you know someone would have been positive that you're in contact with, or if you're just not feeling well over that period of time, then you should get tested also. And one of the things that we know for a fact is that if proper hand hygiene is in place and measures are in place, such as wearing your mask and all of that, you should see less cases of that being present within any given space, home, organization. Mental health is important, and we recognize that a lot of families, because of all of the stressors that's associated with COVID-19, would have had a much more difficult time during this period. And also because of the fact that some of the methodology that we use to relieve stress, such as engaging with other persons, being in close contact with family members, would have been curtailed over this period of time. And so you were basically left to fend on your own. But I can say very clearly that there are a lot of institutions with programs that are set up for persons who may be under a lot of stress, whose mental health is affected. The Ministry of Health has a hotline that you can call at any point in time to talk. I know for a fact that most of the religious organizations also have in place persons who can offer that support. And so it's not a case of trying to solve it all by yourself. This is a case in which the help is needed, and you should reach out to the mechanisms that are in place to get you that help. Health is the responsibility of the Ministry of Health, and healthy people, of course, is what is needed to drive a country forward. And so we do encourage persons to keep utilizing the means of getting information on COVID-19, to keep the measures that are in place. Wear your mask, wash your hands, and maintain some amount of distance to prevent the propagation of this disease.